Good morning. So let's start with today's topic. And this is about patient's reaction, right? And it is very much necessary to figure out that whatever the questions which we are asking, how the patient is responding and how the patient is feeling about it. So that's why the topic dive in patient's mind to be a great doctor. And seriously, it would be super interesting. So that's what we talked yesterday about, right? It's the last time that as a doctor, what would you ask to patient? Now our expectation is that patient will be like courtroom, such or such के सिवाय कुछ नहीं. It's That's what our expectation is. In reality, things would be very different, right? So, but last time it was this path, and this time we are dealing with this path. That how the patient is responding to doctor's interview or the doctor's question. So that's patient's response, right? Now see, the patient would respond to illness. Patient will be giving response to interviewer, that means doctor or the medical faculty. Then influence of background plus age. You'll find that kids will be behaving different, right? Old people, they'll be behaving different. And on top of it, how the disease will be changing the opinion and the mentality of patient. So final effect is it's a combination of point 1, 2, 3, 4. Combination of all is what we'll be getting in the form of patient's response. So let's start with first response to illness, right? So over here, we are not right now talking to patient. How the patient will be responding to illness. See, there would be feeling of discomfort, right? Feeling of helplessness and decreased interest in future. This is the beginning, right? Now, what I really wish is, as we discuss these points, you keep on thinking about any of the relatives or any of the known people, right? Those who have suffered from any of the illness, how do they react? Because once you know this, in case, right, say, God forbid, any one of you ever suffer from any of the problem, but when we know this thing, yes, trust me, this is again, I'm telling you from my own experience, we know how to fight in case if we come across any of the major illness, right? So there is definitely discomfort, right? There would be pain, there would be discomfort. We feel helpless, right? Especially say during COVID when it happened, right? Yes, I was isolated for full 30 days. You feel so helpless, right? That why things are not working fine. And there is decreased interest in future because you are purely focused on somehow you need to get well. The emotional reaction, right? There would be anxiety, right? There would be fear. Yes, definitely there would be fear. Depression, well, depends. Anger, depends, right? There is denial. Means if anyone tells you want to eat this, that, no, no, you just say, keep on telling no. There would be frustration if the results are not coming good. The blood has gone for the lab test, and when the report comes, if it is not good, frustration. There is withdrawal, right? You feel like that no, world is not good, and at times exaggerated symptoms, right? All these things, not all of them they appear together, but some of them they keep on appearing and they come and go. So let's talk about in more detail anxiety, right? There is inability to accept love and care. This I have written in different color. Yes, there would be few patients, right? Even if someone is trying to help, you try to help such patients, still they won't be able to accept it, right? They'll say, okay, no, this is all natak, right? No one is caring for me. So inability to accept love and care, this is very dangerous situation, right? This is very dangerous situation. Then there is state of uneasiness. There is state of uneasiness, maybe because of some danger, but this is totally non-specific, completely non-specific. When we say fear, no, that's the difference between state of uneasiness and fear. Uneasiness is without any specific reason. When there is fear, then there is a specific reason. Yes, someone is afraid of dogs, someone is afraid of bat, someone is afraid of closed spaces, claustrophobia. So there is a reason. Over here, there is no reason, right? Even if the patient is recovering, but still they'll be anxious. कब ठीक होंगे, कब ठीक होंगे? That friend, he was fine within 2 weeks. Why things are not going so good, right? So this is state of uneasiness. Depression, many types, right? This is a chronic state of lowering of mood. This occurs especially in chronic state, right? All those long-term cancers, etc., right? Or the tuberculosis. In such cases, chronic state of lowering of mood, because every day, one, drugs, they don't act like the way we take the medicine for headache, right? After 45 minutes there is no headache. Not like painkiller, right? We have taken a painkiller and pain goes away. These are the chronic state, right? Long term. Even if someone has taken medicine for 1 month, still results are not that good because it takes more time. So this is chronic state. Mood keeps on going lower and lower, and depression keeps on mounting. It could be reactive, it could be neurotic, or it could be maniac, right? Person goes crazy. So amongst many symptoms, right? There are so many symptoms of depression, but these three, one, crying. Yeah, they do cry, right? When the depression mounts. Self-respect is lost, and then they start blaming themselves. This is self-accusative. If these three things are found together, right, chances of depression, they are severely high, right? And you need to manage these patients in a very different way. We'll be talking about even that, how to manage such patients, right? But first, what we are trying to learn is this: the response to illness, right? Response to illness. That means some disease has already arrived, and now how the patient is responding or behaving to that particular disease. So anxiety, depression, and now very important part, decrease interest in activities. Think it like that you are also learning psychiatry right now. This is what is called as the patient psychology, right? Patient psychology. So they decrease interest in activities. That's why when you go in ward, you'll see that most of the patients, right, they will be sitting very silently, just not doing anything, staring at the ceiling. Only few patients, right, they might be reading something or listening something, right, or talking to someone. Insomnia, again because of anxiety, there is decrease and increase appetite or weight. Now, is it necessary that we see all these symptoms only when the patient is in ward? Not. No. You'll find this thing amongst many students, especially medical students. So that's why I say, don't take everything so seriously. In case if anything goes wrong, if in one subject some less marks have arrived, that's not end of the world, right? All of you should not be developing any of these symptoms like decreased interest in activities, insomnia, increase or decrease in appetite or weight, loss of energy, feeling of guilt that whether I'll be successful in this, nay, friends are more successful, decreased focus and concentration. This is a killer, especially from the student's perspective. This is a killer. The moment you lose your focus and concentration, everything goes bad. Everything goes bad. This is the worst of the worst thing. When the thoughts of ending your own life, it starts coming in the mind, right? But see, if any of these thoughts they start coming up, beware, right? The best solution, talk. Always talk. Few of the emails, say those you have sent it about say 4 or 5 days back or 1 week back, and I have not yet replied, and few of the emails which were sent even 6 hours back, I have replied to them, is because of this reason. I really don't want anyone to reach to this level, right? And it is completely fine. When you open your heart, you write everything in your email. Trust me, it will remain with me only. But yeah, this is what is needed. Always talk, even with a minor frustration that this is not happening. No worries, right? And don't worry about whatever ministers they say, right? Yes, they keep on passing many of such statements, right? So you don't have to use your morale, or you don't have to lose your confidence. Whatever you are studying, if you feel like that your university, right, your university is actually not teaching things to that high level, don't worry about it. Again, I'm telling, it's not end of the world, right? You must, to whom I'm talking, right? You gentlemen must be knowing this. You must have understood, right? Don't worry about it. No need to change any of the university. Learn very properly. Think it like that. In case if you want to go to US, yes, your plan will be to crack USMLE. Once you do that, it really doesn't matter from where have you passed your MBBS. What really matters is how much you know, and then move ahead in your life, right? But whatever you learn properly and be the best. Don't compete yourself with anyone in the class. World is the stage, right? You have to compete with the rest of the world. So this is for everyone, those who have sent mail or not. But remember this thing, right? It's fine. It happens. Some things are not going properly. Don't worry. Talk. This is vital. Do talk, right? Okay. Because diseases are not always like physical disease, right? Diseases are even when they start mounting, even from the perspective of our brain also. Denial, acting or thinking as if part of the reality is not true. This is what really happens in case of chronic illness, dying patient, psychological patient. Now suddenly they start feeling like, nahi, mujhe to kuch nahi hua, I am okay. They'll start behaving like, they'll start denying कि no, this is what doctor is telling is not true. It's because such patients, they are tired, इतने थक गए हैं कि now they are not ready to believe, right? And they really think that part of the reality, something which has really occurred, it is not true. Many of the serials they have prepared, they have started making serials on such factors, right? So chronic illness, dying patient, right? If you see dying patient, right, suddenly they'll be hyperactive. They'll start speaking so much. And this psychological, a huge topic, right? Massive topic. But yes, those stages, if it is chronic, so then they don't start, they start avoiding the reality. Now, this is one example. This is a real example of a student, right? He was senior to us. Yeah, he was senior to us. And if you ask in canteen, if you ask him about the blood supply of brain, right, he would be explaining circle of Willis in the most beautiful manner, right? As the exam approaches, right, his approach would be, ये एग्जामिनर मुझसे क्या पूछेंगे, I know more than any one of them, I don't want to appear for exam, right? When we saw this person, we were in first MBBS, right? We reached to final MBBS, still this guy was in first MBBS only. So it's not so that he was not intelligent, but this is a psychological problem, right? So it's a huge, say, section in which so many things they are coming under that cover of psychological depression or psychological changes. The projection to impose on others, right? Such type of patients, you'll find them, and they speak so much, right? And when the relatives come, yes, I'm telling you why for these type of patients, because at times, again, this really happened in during our clinics. Say you and me, we go to a patient, right? And then we auscultate, And if I ask you, दोस्त systolic murmur सुनाई दे रही है, right? You will listen, you'll say हाँ हाँ, but see, there is an ejection click also. I say अच्छा, and then I and listen to that. Now what this patient would say, अच्छा, see, he is asking for solution to someone as my case is difficult. देखो, एक डॉक्टर को तो पता ही नहीं चला, उसने ऑस्कल्टेट किया, उसको तो पता ही नहीं चला, उसने वो स्टेथोस्कोप लगाया, उसको पता ही नहीं चला, दूसरे को पूछ रहा था, right? So this is what they try to project, to impose on others, and they spread these things to their relatives, right? The doctor is not efficient, and he is asking for solution to someone as of my case, as my case is difficult. There is nothing like that, but yes, they project it like this. So that's why in clinics, right, whenever you take your findings, don't discuss the things in front of patient. Even let's say two or three friends, they are over there, everyone would auscultate and then go out and then discuss. It is absolutely fine if you go back to that patient and auscultate again, but don't discuss in front of them, right? Many of these things, they are not written in books, but when you in real life, yet it matters the most, because see, that patient is sitting ideally over there, he has got no work, right? And then when he starts observing you, because you are observing him, you are auscultating him, but he is observing you, and then his horses will start running, उसके घोड़े दौड़ने शुरू करेंगे. Your every statement will be manipulated, right? Not everyone is like that, but many of the patients, they will be like this. Regression, they try to return to original state. Now this is the extreme. They say, no, I am absolutely fine, I am okay, cancer has gone, right? Even if there is amputation, they'll say no, I'll go to washroom by myself, right? खड़े होंगे, खुद ट्रैगन गिरेंगे, but they'll say no, this is just for one time, otherwise so I go to washroom by myself. That's what they try to do. They try to return to original state. Over here, you need to become strict, because it's not so that when he'll say no, see, I am so positive. No, they are not positive, they are regressive. That is regression. They try to return to original state even against medical advice, right? So this is where you need to be bit strict. No need to show any empathy, any sympathy, right? Any daya on them. No, strict, you have to be strict, because otherwise you know that this is a case of fractured tibia, right? Why to put weight on his legs and unnecessary give a chance for the dislocation, right? So this is like that. On to the patient's response. So this is the first part what we talked about, that how the patient will be responding to various illness. Now comes the most interesting part. This, I always say, this is the most interesting. And at times you will find that, yes, I'm not able to find Shaloko. No worries, right? Just send a mail, I'll send you the PDF. Though it is over there, but no need to waste your time. I'll send it across. Right? It's a matter of 2 minutes for me, no problem. I'll send it. Coming back to this, so to interviewer, that means doctor. Right? Last time we studied about this, right? When how you ask questions, right? In spite of all your intellectual behavior, right? Absolutely professional behavior, very good diagnosis, everything is fine. You are good from your perspective. Now see how patients they really think, right? And this is seriously so funny. When I was making this thing for the first time, that silent patient, right? This is like lifelong shyness. Means you ask them that, yes, बताओ क्या हुआ? कुछ नहीं, मैं तो ठीक हूँ. So then why are you here, right? And they'll be into lifelong shyness. Absolutely, you have to ask twice, thrice. At times you become, we get irritated. That बोलना भाई, तकलीफ क्या है? There are so many patients in queue, and this thing classically happens in when you are into government hospitals, right? They are super shy, and that's where you have to figure out that, ask some of the things from his or her relative. When they start speaking, and as you say, ठीक है, this is normal, right? Then they will say अरे नहीं नहीं साहब मुझे नहीं ऐसा होता है वैसा होता है, and then they'll start speaking. So you need to break the ice. This is what is called as the breaking the ice, right? This is extremely vital, extremely vital. That's why I always say all doctors, you all should be super smart. Now, say though this is like, I don't know about you, but say at one stage of life, right? It's like to talk with a girl, लड़की से बात करना was like कि यार बॉस हिमालय पे जाके आ जाते हैं, but talk with a female is a very difficult thing, right? But once you are confident, so that is, then it becomes easy. Then you feel like, हाँ यार, it is so easy, right? What's the problem? That's what is called as the breaking the ice. Same thing is with such patients. Same thing. These are that patient which are with lifelong shyness. Right? So very important. इससे बिल्कुल उल्टे, over talkative patient. दुनिया भर की, right? They will try to dominate you. Right? This is the first thing. The moment any patient tells you, you say कि अच्छा क्या हुआ, अरे साहब वो तुम्हें बताता हूँ पहले मेरी बात सुनो, सी मैं तो इस गांव में रहता हूँ वो उस गांव में, and they will try to dominate you. The moment they say such things, any of the such things in which they cut your sentence, right? They cut your sentence, they don't let you speak. And if you ask just one simple question, their answers are long, endless answer. Endless answer. Your simple question कि ठीक है फीवर कब से था, and then he'll talk about his great grandfather, right? He'll talk about his grandfather. He'll say कि अच्छा वो तो कभी दवाई लेने गए नहीं था, बस कुछ होता था तो तुलसी के पत्ते खा लेते थे. अब देखिए साहब मुझे ऐसा था, पहले इतना फीवर आया, फिर मैंने बर्फ लगाया, फिर मुझे लगा फीवर नहीं. अरे बॉस, why, right? He'll be going for literally such long endless answers. These 2 points, now you know that these are like over talkative patients. For all these over talkative persons, avoid being silent. Right? Last time I told you that you have to listen, right? Right? This is what we learned last time. Right? You listen, you observe, but not in this case. That's the reason we need to know the psychology, because if you are silent, if you don't speak anything, it will encourage them कि अच्छा देखा डॉक्टर इंटरेस्ट ले रहे हैं, right? It means whatever I'm telling is so important, and then he'll give you all crap, and it would be over detailed, over detailed. This if you find, then immediately interrupt, start interrupting, right? Don't encourage them, because then it would be very difficult to control such patients, right? Their main function, their main characteristic is they dominate over you, right? What's the disadvantage? It's okay, right? No, it's not okay, because when they dominate, they don't mind insulting you. So in spite of your all efforts, right, if you don't get the credit by the end of the day, that's not good, right? So that's the reason you have to dominate over them. This is the point. So avoid being silent, right? Very important, and do remember this, avoid being silent, right? So these are the main points. The third, yeah, seductive patient, right? So if you are very handsome or if you are very beautiful, right? Yes, there are such patients. And see, it happens like, say you are brainy, you are good looking. Now it's not their fault, because they know that डॉक्टर बनने के लिए कितनी मेहनत की होगी. So this guy is brainy or this girl is brainy. You are good looking. So they start harboring fantasies, right? Tremendous fantasies. Now they just can't show this thing to you, right? They just can't speak this thing. So what they try to do, they start becoming flashy, right? They'll start telling such things that if you have got this point in your mind, immediately you'll know that this is the intention of this, his or her intention, right? They'll try to expose themselves. Now you are smart enough to understand that they will try to show कि अरे मुझे यहाँ पे दर्द है वहाँ पे दर्द है, right? They'll try to show that. Now, being a doctor, you have to examine. So that's what they really want. And this is one of the observation. Now, normally, say these patients, they'll be slightly more attractive. They'll be slightly more beautiful or handsome than average person. So they do have that fitur in dimag, right? कि boss, we are very very good looking, we are very attractive. So डॉक्टर तो जो है ना बस मेरे पे खुश हो गया या मेरे पे खुश हो गई, right? All these are fantasies. Remember, all these are fantasies, right? There was one movie also. I don't remember name of the movie, but I think most probably Urmila Matondkar was there. That she falls in love with that doctor, and then when it comes to reality, then she goes crazy, and then she is taken to psychiatric ward, and she becomes maniac, all those things. But yeah, that's the reality. That's the reality. Another important thing, they give extra importance to doctor's instruction. And what happens, that you are telling to sister, right, that ठीक है, say give this tablet, right, any of the tablet ABC, right, every 8 hours, right, every 8 hours. So this is the tablet which is to be given TDS. Every 8 hours you give. Now see what happens. Such patient, next day when you go in round, right, they'll keep so much of extra info, they'll give so much of extra importance to this thing कि सर आपने बोला था ना कि एवरी 8 आवर्स, कल सुबह मुझे टैबलेट 10 बजे दी, मुझे उसके बाद दूसरी टैबलेट जो है शाम को 6:15 पे दी, रात को 2 बजे टैबलेट देनी चाहिए तो उन्होंने तो मुझे 12 बजे दे दी, right? They will complain about the systems, because this is where you become cautious. They are giving extra importance. Now you know it very well that any of the tablet which is to be given TDS, so you definitely finish off everything by 12, because there is no point in waking up the patient at raat ko 2 baje and take this tablet, right? So that's not practical, but yes, it happens. In this case, avoid empathy. Though this is like very harsh thing, right? This is very harsh thing, patient, because finally the patient is patient. But yes, avoid empathy and don't give any reassurance कि इतने दिन में ठीक हो जाओगे और इतने दिन में ठीक हो जाओगी. No, don't give any reassurance, nothing, right? And you have to keep your, say, face absolutely flat, emotionless, right? So here, maintain professional distance, avoid empathy, and avoid reassurance. Avoid empathy and reassurance means avoid both the things, right? Because they will be giving so much importance. If you say कि बस एक वीक में तो ठीक हो जाओगी या एक वीक में तो ठीक हो जाओगे, and in 1 week, right, if he or she is not fine, then see what happens, right? They start shouting, then suddenly their behavior changes, and out of thin air the pain will start appearing in so many other areas, and where you'll find that there is no clue, right? In no medical book such symptoms are mentioned, and that is what really happens, right? Because they try to, say, harbor their fantasies. So be very careful. These patients, angry patients, very easy to handle, right? When they say they are demanding, अरे हमारे यहाँ ऐसा होता है वैसा होता है, right? Aggressive, very aggressive. They can make inappropriate remarks also. They can speak even gali also, right? And there is power struggle. This is what is called as Cold War, right? This is what is called as Cold War. You remember before some time I said that even when you are sitting in your drawing room, right, and say your father tells कि ये मेरा बच्चा, right, he is into first MBBS or second MBBS, the relative who has arrived, right, he'll say just one statement and your father would feel like इसको मैं लात मार के बाहर निकाल दूं. He would say ये डॉक्टर्स तो जो है ना कुछ नहीं आता आजकल के डॉक्टर्स को. What is that? They say this statement so bluntly, and you feel like, do you have any experience? No. People give all sorts of salah, all sorts of advice, especially in medical, even if they don't even know that where is liver and where is spleen, but still they'll see कि अच्छा अच्छा report दिखाओ. Again, this is like a personal experience. When one of my very close relative, right, that person was watching MRI. Yeah, seriously, he was watching MRI and was telling कि जितना black portion है वो सब सड़ गया है, right, this white portion is okay, and you feel कि यार हद कर रहे हो. But yeah, that's what really happens. They try to show off, right? So that's what is called as the Cold War, because amongst that entire room, right, they want to show their superiority, and you are sitting silently कि यार कौन इससे मगजमारी करे, right? Forget, do let's not speak. But yes, this is what is called as the Cold War. Angry patients, there is a power struggle. They think like that, yes, if I make these comments, if I become aggressive, I'll be getting better treatment. Now then everyone will be giving me proper attention. The solution, this is like seriously Rambani Ilaj. You use exactly this statement, and I'm telling you that making this thing as bold. Bold means no harm in speaking slightly, loudly, with authority. That tell me what's the problem, right? When you say this, now suddenly he'll be on back foot. If the patient is very angry, bus use this sentence in your language, right? Hindi, English, whatever the language which is he or she is talking. This is the crux. That tell me what's the problem. तकलीफ कहाँ पे है, right? And then see what happens. Suddenly he'll be on back foot. These are paranoid patients. The next type. The difference between maniac and this paranoid patients, they think that entire world is against them. Entire world is for them, everyone is enemy. So even you'll see their posture will be the closed posture, right? They'll not be sitting, they'll be sitting like this and they'll be watching. As a doctor, you come, they'll say कि कुछ तकलीफ, right? Their behavior would be like that. They'll be watching you as if you are an enemy. So such patients, they require empathy, right? They require reassurance. Because to such patients, if you say, tell me what's the problem, right? That thing would backfire, because immediately they'll go into their shell, they'll not speak anything. So we feel like, ठीक है, who cares? कोई नहीं, दूसरा patient. No, but what if such type of patient is into your USMLE exam? Yeah, so many, still more to come. Still more to come. Because that's the most beautiful thing. This is like, say, when I say that in medical, once you are in medical, right, it's not so that you are dealing with only the drugs and disease and organs, you are dealing with real life, right? It is very easy to handle robotics. It is very easy to handle all these routers, switches, firewalls, very easy, because you know that you give this command and the response would be exactly the same. You give IP config and immediately on your command prompt, and immediately it will show you IPv4, IPv6, what is your domain name services, DNS, whether it is a DHCP activated or non DHCP, everything will come crystal clear. For patients, things are not like that. So that's why the beauty of medical science is that when a question is asked that after medical you went into engineering, right, and then you went into graphics and cybersecurity. Yes, because once you are into medical, your brain is trained to handle such situations, the situations which never ever comes to that severity in engineering or cybersecurity or graphics, right? Yes, so many types of patients, right? So they think world is against them, right? The next is insatiable patients. They are never satisfied. Between silent and paranoid, see, these paranoid patients, right? The silent patients, if you look at their facial expression, they'll be very shant, right? In fact, if you ask them कि क्या क्या पेट में दर्द हो रहा है, so they'll say yes, right? But their expressions, they'll be very like chota bacha, right? They'll be very fine. And in case if that patient is like a female patient, and if there is any problem of the gynecological problem, or if she is having any pain in the breast, so then they'll be so shy, right? The friend they might tell her friend, or they might tell her mom कि, "Ma, tu batana," right? They are typically shy patient. Paranoid, paranoid तो आपको देखते ही पता चल जाएगा. The moment you say, right? And at times they make such statements also, right? And statements are very insulting. सब यहाँ मारने के लिए बैठे हैं, ये क्या सब है, कुछ नहीं है, मरने ही वाले हैं सबके सब. Such type of insulting statements, right? So much so that in civil hospital OPD, right, many times, because till you don't wear the apron and you don't take the statho out, no one would know, right? So sometimes when you are waiting for your fellow doctors कि चलो आए तो फिर सब साथ OPD शुरू करते हैं, you'll find that many of the patient they say, यार कुछ नहीं आता इन डॉक्टर्स को, राइट, सब मरने वाले हैं, राइट, एंड दे विल बी स्पीकिंग सच स्टेटमेंट व्हेन दे कम इनटू ओपीडी, राइट, व्हेन यू स्टार्ट एग्जामिनिंग, तो दे विल सी यू विद सो मच ऑफ सस्पिशियस, राइट, शक की नज़र से. एंड दैट्स व्हाई इट इज सेड one universal law, right, especially in cases of relatives or friends. Say here is your friend, right, who has got total belief in you, but his or her relatives, right, or the family members, if they don't trust you, don't treat them. You are wasting your time, you are wasting your potential, and actually with the same drug they won't be fine. They won't be good. It won't affect them, because there is no faith. There is no faith. Faith matters, right? Even if you are scientifically correct, but they feel like no, no, he is not good. So forget, don't treat such patients. When it comes to your own clinic, things are different. Right? That there you handle them very differently. But this is one real example which I am giving you, real life. The next is this insatiable patient, they are never satisfied. They will follow your instructions, right? They will follow your instructions, but still they say कि ठीक है, मुझे पाँव में जो दर्द हो रहा था उसके बारे में डॉक्टर ने नहीं पूछा. Yeah, not only asked, you are given actually such patients in the step 3, right? In step 3 of USMLE, you are given the cases. So here is patient 1 which is given to you. He is not actually a patient, right? They are actors. But they are given clear instructions that you'll be behaving like an insatiable patient, or you'll be behaving like a seductive patient, or you'll be behaving like a shy patient, right? So that's what the role which is given to such actors. And if you they are all very good actors, right? This is a speciality. So if you tell them that okay, hold your breath, right, they will hold their breath, but because this is a case of, let's say, emphysema, he won't be able to hold his breath for long, so immediately after a few seconds they will release it, right? You tell, so they just really want to see that how will you really handle the patient in the real world. So these actors, they are very efficient, and because these actors, they will be giving you the marks that how well you handled us, right? No doubt there is always a video, right, video shooting, but everything matters. So that's why it is necessary to know these things, because suddenly when in USMLE, when such patients arrive and you feel like कि बस अपने marks कट कहाँ हुए, इतना तो अच्छा diagnosis था, right? This is where it matters. So insatiable patient, how will you handle such patients, right? Those who are never satisfied. This is where you have to become a better actor. Right? Why they are not satisfied? First, their ego. They are super high. But one statement which I have found very effective, one statement that this is the injection which we give to only special people, right? Otherwise normally ये सबको नहीं देते, क्योंकि थोड़ी तकलीफ होती है पर जल्दी ठीक हो जाते हैं. And then suddenly he'll feel कि अरे मुझे importance थी, right? Their face would change, right? They'll give you such smile, right? And then you'll find कि yes, everything goes fine, and they really become well also. You have to show them some importance. We need to break their ego. But this is only in the proper setup. Now this is ingratiating patient. They try to please the doctor, right? Not much to worry about such patients, because you tell them suppose avoid tea or coffee, right? You are given this simple instruction, but they try to please the doctor in a way, right? When in ward, right? अब अगर जो चाय नहीं पीनी, एवरी डे द टी इज गिवन टू देम, दे कैन इजीली से कि नहीं मत देना चाय, राइट? नहीं पीनी, तो देन that tea won't be delivered to them. Now they will take that tea, they'll put it on that side table, right? And that cup is lying over there. When you go involved, they say कि सर आपने बोला था ना चाय नहीं पीनी, देखिए मैंने नहीं पी, वो रही वहाँ पे, right? So it's, they try to please you, that देखो आपने जो बोला मैं फॉलो कर रहा हूँ या मैं फॉलो कर रही हूँ, right? These are like ingratiating patient. They will try to please you with the proof, don't give much attention to them, right? Just say okay, good, right? Continue, इतनी दवाई ले लेना, and they will take, right? ऐसे patient ठीक भी जल्दी हो जाते हैं, they'll be fine. The aggressive patient. Now see, this aggressive patient is totally different from this angry patient, right? Angry patients usually they are very rich, right? You'll find them that they are very rich, and they will find कि अरे ये चीज़ नहीं है, वो चीज़ नहीं है, or at times if they have come from some very say some other country, right, where facilities they are much better, they'll keep on comparing the things. But finally, if you handle them bit properly, ठीक है, they come back to the ground. That's not the case when it comes to this personality disorder patients. In personality disorder, तो you have to treat them. You have to treat them. You have to actually add specific medicines, right, to calm them. Otherwise, this is like a personality disorder. They can become violent. They can become violent. So now it said that over 30% of people, right, they have got some psychological problem. That's the reason in USA, psychiatry is considered as at a very high level, very high level. You must have noticed that few of normal people, I'm talking about normal people, from the medical point of view, you try to give some advice to them that, okay, for this particular condition, why don't you try this? Their response, well, I'll Google and I'll let you know. Now, when you Google it, right, you'll find that this is a very complicated thing. The articles are over 150 pages of article. They will avoid you. They will avoid you. They want all things in shortcut. Now, this is what? This is a problem of personality. This is a personality problem. You know it that this is a personality problem, but can you convince this person कि boss there is a problem in you, दोस्त दवाई ले ले, right? Do some counseling. पहले खुद को treat कर ले, then you start treating others. No, नहीं मानेंगे आपकी बात, right? So this would be whenever it comes to personality disorder, now you'll find that there is a huge gap, right? They are never ready to believe that they can go wrong. Once you will learn psychiatry, at times आपको खुद को डर लगना लगेगा. Seriously, I'm telling you, you'll be afraid कि यार ऐसे ऐसे पेशेंट होते हैं, yeah, and to handle them, it's like a nightmare. Now tell me one thing, these type of people, right, you know what they do? As a doctor, right? Recently, there was one discussion on this. As a doctor, if you charge 1,000 rupees for your consultancy, right, just 1,000 rupees for your consultancy, you are charging this 1,000 rupees after how many years of studies? Minimum 10 years. ठीक है, 5.5 साल आपका MBBS, 1 year internship and 3 years of post graduation. Not talking about any of the post graduation and the specialities and your experience, forget about that. At least 10 years. ठीक है. There is problem in the electricity. You call that electrician, right? You call that electrician, he is changing just 2 switches and then he'll say साहब 800 रुपया हुआ, right? कैसे 800 रुपया, right? दिल से 100 रुपए के स्विचेस और डालने का चार्ज एंड विजिटिंग फीस एंड इनके थोड़ा काम करो तो भी ही टेक 700 रुपया लेके गया. How much time he has spent for this, right? It's not that complicated. Plumbers, the way they charge, huge as compared to medical, I'm telling you. And we never argue with them. But the moment it comes to like doctor starts charging, they say they are unethical, right? Advocate, right? If he is charging anything, हाँ वो तो होता है ना, ठीक है. That there is never ever the argument, there is never bargaining. But so any community in the world, if they are charging, it's all good. But if the doctor is charging, तो they say कि ये तो लालची डॉक्टर है. This is why this thing is so much and why it's not so in other countries. In other countries, things are not that bad. This is what is called as the personality disorder. They feel like bas ye doctors, right? And then this thing spreads. They tell patient to relatives, and this is like a trouble. This is like a disease. Next is help rejecting patients. Help rejecting patients, right? They believe they have done enough sacrifices, right? And countless disappointments in their life. अभी इस जिंदगी में कुछ नहीं बचा, right? They will be, मतलब आपका दिमाग खराब, फिलोसॉफिकल, इतनी फिलोसॉफी, राइट? अरे यार, वर्ल्ड इज सो ब्यूटीफुल, राइट? लाइफ इज सो गुड. नहीं, एवरीथिंग इज वेस्ट. I sacrificed this and I sacrificed that, and then there were countless disappointments which he or she will talk about. And if you try to help them, नहीं नहीं चलेगा, इतना पेन तो नहीं चाहिए, राइट? दवाई नहीं चाहिए. दर्द, पेन वो तो हम सहन कर लेते हैं. लाइफ में इतने दर्द सहन किए, इतना तो कुछ नहीं. All sorts of things will come up, right? So that is where at times instead of tablets, we have to shift to injectables. You know that they won't be taking tablet in front of you, so they'll say, but the moment you start hearing them speaking all these kathas na, shift them to injection. Because for tablet, see, in general world, what happens, sister would come and will give the tablets to chalo, take this tablet, take this tablet. Now sister, she has to handle 60 patients in a ward, right? So she won't be standing over there कि चल tablet ले उसके बाद मैं जाती हूँ. No, she'll give. They throw away those tablets. Classically, those tablets, they are thrown out of the window, right? Windows are big, so at that point which is just outside that खिड़की, वहाँ पे tablets पड़ी होती है. So this is what really happens in such cases, right? If it is a post-surgical thing, right, and if there is a pain associated, start giving injectables as a patient. That way they will become much better faster. Demanding patients. They force others to take care of them, right? And what they do, first guilt, sorry, I've written it in wrong order. Let me change it. They use anger first and the guilt later. These are demanding patient, right? They force others to take care of them. And first by anger. अरे मेरा ये काम कर दो, मेरा वो काम कर दो. Whole people reject whole moment. You are right. Right? Especially when you hear them कि ये मेरा लड़का या मेरी लड़की, ये तो मेरे कुछ ध्यान ही नहीं रखते, देखो मुझे यहाँ छोड़ के चले गए, राइट? बस अब तो मैं आप लोगों के सहारे. right? All sorts of things. And in case they again, if these are the three or four say beds, right, and such patient is on bed number 4, right, he'll say, अच्छा यहाँ पे डॉक्टर आए, फिर यहाँ पे आए, फिर यहाँ पे आए, मुझसे तो सिर्फ दो दो सवाल किए और आगे चले गए, देखा, डॉक्टर भी ऐसा ही है, राइट, ही इज नॉट गिविंग मी एनी इंपॉर्टेंस। इनको कैसे 3-5 मिनट तक, नाउ इट हैपन्स लाइक दिस इज द कार्सिनोमा ऑफ स्टमक, एंड देन यू आस्क क्वेश्चंस टू द रेसिडेंट्स कि ठीक है चलो डिस्क्राइब दिस और डिस्क्राइब दैट, और you have say listen to the history in detail, and this is just a gastritis case, right? So you are over there and you just ask few questions and then you move on, but they will say कि no, देखा इसको कितना ज़्यादा importance दिया, yeah, what sometimes patient can be more dangerous than most diseases, yeah. So no, it happens, and then they speak कि देखा वो 2 नंबर का पेशेंट, राइट, 2 नंबर का पेशेंट, उसको कितना कितना ज़्यादा टाइम दिया, मुझे तो कुछ टाइम ही नहीं दिया. So do remember these things. For such, even if you give them 2 minutes, take their name, talk very friendly, and so then they will be happy कि देखा किसी का नाम नहीं लिया था, मेरा नाम लिया. हाँ, so these are the patient demanding patients, right? First, anger. चलो एंगर तो ठीक है, यू डोंट केयर, दो सिस्टर्स एंड वार्ड बॉयज, राइट, दे आर वेरी ट्रेन्ड, दे से फॉरगेट, जितनी चिल्लाना हो चिल्ला ले, राइट, दे डोंट केयर. बट देन दे विल स्टार्ट क्राइंग, दे विल गिव द गिल्ट, कह रहे देखो मैं तो इतने दिन में मर जाने वाली हूँ या मर जाने वाली हूँ, मेरे लिए अभी इतना कर दो उतना कर दो. दैट वुड बी द थिंग. Yeah, many of the patients they will be in mixed category, right? That's why yeah, our attitude is very important there, because then you start identifying them, right? But one thing is very true, you'll find them that even if there is mixed category, now one category will dominate very much, it will dominate so much, right? So if you just handle it, बाकी का सब तो खुद handle हो जाता है. But this part, guilt part, बाप रे बाप, right? Handle it very carefully, right? Because you will find that क्या facilities मांगना शुरू करते हैं ये लोग, because and everything by guilt, right, कि मुझे तो ऐसा हो गया वैसा हो गया. Now these are compulsive patient. Again, not pinpointing any of the specific, but those who are like super rich or coming from developed countries, you'll find that, let's say if they have come for TKR, right, total knee replacement, they have flown all the way from other country to your country. Definitely they have come from that country to this country because things are good, right, things are cheap, but they will be over concerned about every detail of their lives, every detail. They are compulsive patient. अरे हमारे यहाँ तो इधर न्यू जर्सी में it was like this and that, and with all the things, every time comparing it, that our life is like over there. देखो यहाँ पे तो लोग कैसा रोड पे चलते चलते थूक देते हैं, केले का छिलका फेंक देते हैं. हाँ ठीक है बॉस, दिस इज इंडिया, राइट. द सेम पेशेंट, राइट, who is in say on New York airport, he'll be chewing the gum and putting the wrapper into their pocket. As soon as they land in Chhatrapati Shivaji International Airport, declare हुआ ये बाहर फेंका, right? But can't change all of them. But over here, when they are patient, it matters, right? It matters. So at times, such patient, they become thankless patient. They become thankless. So don't expect much. It's okay, right? If they are thankless, your job is to give them the treatment. And but definitely, once the patient is thankless, he won't be better by your medicine faster. It would take more time, because when they are thankless, there is decreased faith also, right? Reverse. Dependent patient. Life is difficult without help of others. They are dependent patient. For every small thing, right, they will be telling, इनके लिए पीछे पूरी फौज खड़ी रखेंगे. And such patients are like what? You will find, means you have to literally say कि अरे इतने सारे relatives चलो सब बाहर, right? मतलब वो अपना लड़का लड़की उसके उसका भाई बहन दिस दैट एवरीवन, अच्छा तू ये ले आ, अच्छा तू संतरे ले आ, अच्छा तू दवाई ले आ, राइट, तू डॉक्टर से मिल ले कि मुझे कैसा है, राइट. Everyone will be kept on their toes. Life difficult without help of others, right? And they talk. You are playing chess in real time to deal with patients, and not only that, you are one, and you are playing against 10 different players in 10 different styles, right? And you are playing chess with multiple people together. So it really happens like that. You attend any of the general OPD, right? The best is you general OPD, you where you are watching from 9 o'clock to 1 o'clock, right? 9 a.m. to 1 p.m. And you are watching, let's say 60, 70 patients, right? 60 patients. So every hour you are watching 15 patients. That means roughly about 4 to 5 minutes per patient. By the end, मतलब वो 1 बजे ना, we literally used to rush to the canteen के बॉस पहले एक बढ़िया कॉफी पिला दे फिर खाना खाते हैं. मतलब your brain would be emptied to that level. Means, means though it looks like कि इसमें क्या, but ये खाली हो जाता था. And then you have got OPD all the way from Monday to Saturday. Right? तो संडे तो हा was looking like a heaven. चलो चलते हैं मूवी देखने. That was the life. Another one, masochistic patient. These are the patients, they feel like they are Superman. They'll feel like they are Superman. They'll not, you tell them to take rest, they'll say क्या रे, right? मर्द को कभी दर्द नहीं होता sort of patients. Even if things are painful, you tell them कि boss don't do this, no. You tell them कि ठीक है don't eat spicy, right? No smoking, no alcohol, and their attitude, doctor तो बोले, उससे क्या, right? They'll function despite their problems. And when the problem worsens, yes, then they come back to you, अरे डॉक्टर साहब अब बचा लो. This is again, I'm telling you from real life. Right now also I'm handling such patients. Well educated, huh? Well educated. You tell them that अरे यार this is bad for you. तो दिल से कि नहीं अभी अभी कम कर दिया है, right? You know what I'm talking about. Such, when you know that this is dangerous for life, but they'll say they function despite masochistic. Borderline patients, instability in their personal relationship. These are borderline patient, right? They have got their personal relationship problem. There is instability, and that leads to so many complications. Now see, when there is such type of problems, a personal relationship problem, so the problems, hormonal problems, they become very severely manifested, right? So such patients are to be taken care of in a very calm, cool way. Right? Moving on to the influence of background and age. When the patient is child, right, patient will be डरा हुआ, frightening experience, because when he watches that stethoscope, right, that child will go into his or her own shell because he has never seen doctors. They are dangerous, right? In such cases, let parents stay with kid. There would be better recovery. Even if you have to examine that kid, right, let that kid sit in the lap of a mother and then examine. If the child develops faith in you, so then that is the best thing, right? That's why if you are taking pediatrics, right? So if you have opted for pedia in a post-graduation part, this is the most difficult thing. They said there is no difference between child and adult. There is no difference, right? Diseases are same. Some of the diseases they are specific for child, but the only problem is that this child has got only one language while adult has got a different language. This child has got only one language, and that is right, crying. It is like you have to decipher that language to figure out what's the problem. Right. So this is one. Aged patient. Right. You only said, yeah. Right. Sally. Old patients reject help more often. Exactly. Aged patient, they need, that's why they need lots of attention. And in spite of giving all the attention, don't expect that they will be giving you some good reward, right? Not everyone is like that, but yes, it happens. You need to give lots of attention. This is to be avoided. Such patients, right? Okay, when I was a kid, illness feel better by seeing my pediatrician even before they would examine. Yeah, that's very true. That's very true. Because that is the specialty of a doctor. That is the specialty of a doctor. Say if many times you get the compliments के अरे साहब मैंने आपसे फ़ोन पे बात की ना मेरा आधा पेन कम हो गया सो अभी मैं टैबलेट लूँ तो यू हैव टू टेल के ठीक है आप एक काम करो शाम को भी अपने फ़ोन पे एक बार बात करते हैं टैबलेट क्यों लेनी अननेसेसरी केमिकल्स डालने पेट में एंड ट्रस्ट मी बाय इवनिंग व्हेन ही कॉल्स अप ही इज सो हैप्पी अरे सर ठीक हो गया राइट सो यस यू आर राइट brain releases so many happy hormones and those happy hormones they can take care of so many things. That is the reason, see, I was telling you that as a doctor, right, why you should be physically so fit, because when they see you they feel like अरे यार ये if he is taking so much care of himself तो मेरे भी इतनी अच्छी केयर रखेंगे, right? So आधे पेशेंट आपके ऐसे ठीक हो जाएंगे. Second, at any of the international level when you are on stage, right, thousands of eyes are watching you, it will make a big difference. Okay, so always keep yourself good, fit, and obviously it is good for you too. For the aged patient, see that they don't go in depression or any of the negative thought, because then it becomes an irreversible process. Immediately you'll find that there is a downfall and it is very difficult to then handle it, right? So try to avoid that they go in depression or negative thoughts, right? For this, the best tool is listen. Listen to them. Listen to them. Next one, widowed patient. Depression and loneliness, it is by default. Because it is said that loss of kid, loss of spouse, it is the highest level of depression producing reasons. So if that's the situation, depression or loneliness, so that is by default, right? This is where the soothing counseling is needed, right? You need to listen to them too. Say, behave with them as if they are elderly patient, right? So let them speak. They feel good. मतलब जो कहते हैं कि अपना अपना दिल खाली कर दिया. So that is when their real good nature comes out, and then you'll find that they become so efficient in their life. Okay, PTSD is a massive topic. In fact, we'll be discussing a full length session on PTSD when we'll be discussing psychiatry. PTSD is post traumatic stress disorder. What is trauma? Now trauma could be anything. Trauma could be that if someone, there is some gundas attack on a person, right? If he or she is injured badly, घर आके भी then they are shivering, right? डर रहे हैं, right? कि यार वो चाकू यहाँ से निकल गया, जरा इधर निकला होता तो ये कट जाता, वो कट जाता, all sorts of things. That is trauma, and there is severe stress about it, right? Especially this is when you are handling those patients, those rape patients. You need to handle them because this it gives so much of PTSD, post traumatic stress disorder, so much. Now that's where say there is trauma, injury, there is emotional numbness. Suddenly you'll find that their all emotions and everything has gone to zero. They become so silent. Yeah, soldiers of war, very right. And especially if they have lost any of the limb, right? If you have to say you come across a soldier and then there is no way out and you have to go for the amputation of that soldier, right? So that is either you have to cut either of his hand or leg. If the limb amputation is to be done, so then that gives severe PTSD, emotional numbness, right? They become so silent, right? And it is not so that they are thinking anything. There is numbness. Remember this thing. One is that person is silent, but he is thinking about 10,000 things. That's a different thing. This is numbness, right? Numbness, zero emotions. Duration of symptoms is more than 1 month. If this is the case, you need to handle them so carefully. Now, say such patients, right? Is it like that some such bad things should happen, like so this rape or those war or there is some amputation, etc.? Well, even in normal life, you'll come across so many people, those who are actually the patient of PTSD, post-traumatic stress disorder. One is what is called as the repeated insults. Repeated insults. This is so dangerous. Remember, this is so dangerous because it affects, it goes into the thalamic system. Would be feeling that traumatic experience again and again in their minds. They don't know what to say. Yeah, yeah. Not at all. Not at all. You know, it's like if the patient person with a PTSD, if he or she becomes a doctor, right? So imagine how brave that person must be. That in spite of all these problems, if he or she is studying medical science, so then her intellectual level is so good and person is so brave that kuch nahi, mere saath jo hua, I'll not let that thing happen to others. So really should salute such person if he or she is trying to become a doctor, or if he's and they become very doctor, they become very good doctor. हाँ डॉक्टर्स दे डू सफर फ्रॉम बिकॉज इट्स लाइफ यार डॉक्टर्स आर ऑल्सो ह्यूमन बींग्स मतलब समटाइम्स यू से कि यार मेरे पेट में दर्द हो रहा है अरे आपको कैसे पेट में दर्द हो सकता है आप तो डॉक्टर हो तो क्या यार वी आर रोबोट्स राइट वी आर नॉट रोबोट्स राइट सो इट हैपन्स लाइक बट इट इज एक्सपेक्टेड दैट यस डॉक्टर्स उनको कुछ नहीं होता से इवन ऑन रोड sometimes yes one of my friend right there was a massive bad accident matlab three of my friends they died in one accident means I was driving bullet right and I said and this thing happened I went to the petrol pump and I said कि ठीक है मैं पेट्रोल भरा के आप लोग निकलो and they were going on scooter with sidecar and they were going it was a highway I my tank I filled up the tank and then my speed was bit high right but then दूर से मैंने देखा कि मैंने कहा what is he doing right it really happened like this was the road right and then a truck was coming on this side I was here and then that scooter right with sidecar it started drifting I don't know why and there was a head on collision all three of them they were chopped off from here and it was the whole sidecar was filled with pool of blood right I actually reached over there right went inside the truck सबकी body को दबाया truck पीछे ले आई then I realized कि only one one person was alive right two died took her into another car right but she also died in my arms way back but still I do remember matlab the literally the whole sidecar was filled with blood that much right so these things they do affect and at that time I was in second mbbs yeah I was in second mbbs still after so many years I remember this thing so crisply and all three were from the same family pura family khali ho gaya single shot and then to inform their parents. And this girl was getting married after about a month or so, and their parents, they were for shopping. So very painful, right? It's like in mortuary when you show them three dead bodies and tell them that no, they are no more. It becomes very difficult. If a doctor is suspected of having PTSD, they are not allowed to attend patient until they have a psychiatrist. Depends. Well, say PTSD is not so that it can easily be diagnosed also. Say if a person undergoes any of such thing, right, there are ways to handle it. When in psychiatry, we'll see, and that's what it is needed, that you should be so strong that any of such things should not be shaking you, because at that point रोना धोना शुरू कर दिया तो unnecessarily you are worsening the situation. So it's not so that they should be, say, psychological evaluation, because who will be evaluating psychologically, right? There is no guarantee that person who is evaluating, he is not suffering from any of such things. So the point is, say, some things are to be handled by yourself, especially if you are in medical, right? Or take a proper advice. But well, there is, like in extreme cases, the way it is said that those who are suffering from Alzheimer's, right, or those who are suffering from any of the disease in which the stability of the hand, finer motor skills, they are affected, so they are not permitted to do surgery. But yeah, many of the surgeons, they do operate, but after that they declare the retirement after some time, that chalo, now it is over. So duration of symptoms more than one, self-hatred, right? Self-hatred, self-isolation, and depression. When these things are added, things worsen, right? That's the reason that for such patient, things are to be handled very, very carefully. Sick physician, right? He is so, right? This is what is called as the student syndrome. In case if the medico is admitted, now he is knowing everything. So yes, he'll say, "Acha, headache hai," right? So what could be the possibility? Well, any space occupying lesion or raised intracranial tension. Can I see properly? Right? मुझे ये हो रहा है, वो हो रहा है, and yes, it happens like as you read more and more, right? This used to happen when we were in second MBBS and third MBBS, right? पूरा दिन पढ़ रहे हैं, right? Cirrhosis of liver. तो then we used to say, यार दर्द हो रहा है, right? And then we say, हाँ थोड़ा बहुत इधर, थोड़ा बहुत इधर, and that's what really happens, right? So they, when such persons, they are admitted, this is what is called a sick physician, right? So they constantly ask और एडवाइस फॉर कि यार मेरा ये लैब रिपोर्ट करा दो, राइट, मेरा ये ईसीजी निकलवा दो, अच्छा ईसीजी दिखाना, राइट, लाओ लाओ एक्सरे, लाइट, आई विल वॉच माय एक्सरे बाय माय सेल्फ, हैपेंस ऑल दोस थिंग्स, राइट. That's where, say, anyone can fall sick, है ना? So here, be a good patient. Be a good patient. If you really want to get well soon, right? So be a good patient. So take best advice, but be a very good patient. Follow it and report properly. Report intelligently. Then see how fast you become good. Right? And now, the influence of disease on patient's response. Depending upon what disease he or she is suffering, accordingly the patient would respond. So that's why it is like combination of all. One, disabled patient, right? This is so really painful, right? Disabled patient. So there is great apprehension, fear, and mistrust. They won't be able to trust on others. There is emotional problem, and then there would be list of adjustments. List of adjustment. Such patient, when you take history, अरे मेरा तो एक, मैं चल नहीं सकता, सो मुझे तो इसके लिए भी इनको बोलना पड़ता है, इसके लिए मुझे मेरे बेटे को बोलना पड़ता है. So many Adjustment lists they will be talking about. Second, cancer patients. Well, God forbid any time you come across such patients, because there are major concerns, five major concerns, and especially in family if it is happening. So this cancer, one, loss of control. There is pain, right? And this pain, depending upon the secondaries, that pain keeps on spreading to so many areas, right? There is alienation, that is estranged or indifferent. You'll find that last month tak to ye bilkul he was talking so properly, and now when you go to his place, तो बस even if you have gone तो still they are sitting silently as if they don't know you. You ask कि कैसा है अभी, right? They'll just say this, right? Not speaking much. They are totally indifferent. And as the disease progresses, right, and then there is mutilation, that is severe damage. Damage increases. All these symptoms they keep on increasing. Finally, the mortality, the death wins the game. AIDS patient, you'll see that there is denial. Yeah, there is so much, there is denial. So they have got fear of doctors, they have got fear of nurses, they have got fear of medical students, they have got fear of medical students, because they fear like क्या रे medical students, nurse, doctor, इनको पता चल जाएगा मुझे क्या हुआ है, right? So there is a fear of denial. They won't talk to you. If you say कि you are a businessman, तो हाँ, then it is fine, they'll talk to you. But if you say कि अच्छा मैं सेकेंड MBBS में हूँ, थर्ड MBBS में हूँ, या आई एम अ डॉक्टर, बस they'll try to avoid you, right? And it's not only in India, anywhere. Dysphasic patient, if there is, they are unable to speak, there is impairment of speech, and there is inability to arrange words correctly. These are the two. Dysphasia, again, it is a very great topic, right? One is, so there is impairment, person is unable to speak, right, when the larynx is totally at fault. But this is inability to arrange words correctly. That ability, that is when you speak something, the whole sentence is created, but then words would be jumbled out, right? So that's why if one has to say that, okay, I am good, right? So he might say, I good am, right? And they feel that it is perfectly fine, all good. So that's dysphasia. The psychotic patients, impairment of understanding realities. They are not ready to understand the reality. They struggle with ever changing demands of their environment. So for them, any of the change, this is the symbol of change, any of the change is unacceptable, right? So even if you move, again, the age related, right? Even if you move their cot from one point to another point, even साफ सफाई के लिए भी जो पलंग को जरा सा भी खिसकाया, खत्म, right? They'll feel like no, there is something wrong. So they struggle, literally, this is one of the very important points, they struggle with changing demands of their environment, right? Any of the change, and they struggle in adjusting it. One member is added into the house, they'll find it difficult, right? Demented or delirious patient, that is when the memory loss, right? Loss of memory, and then they are disoriented. And once they are disoriented, so you'll find then they become aggressive, because recent memory is affected, so they'll be taking the decisions from their past memory. Acutely ill patients, they need immediate and proper medical attention, because this is acute, so chances of recovery, chances of getting better, they are highest, right? So that's why acute illness, so give the proper medicine, proper attention, and they'll be fine. Surgical patient, no doubt about it, right? They feel helpless and out of control. So maintain open communication, always, right? For surgical patients, if you really explain them, If you really, autistic patient also have same problem. Yeah, that's right. That's right. Autism, and especially say for autism, I would say there is one very fine thing, but not very popular in India. This is what is called as for the autism, right? It is, there is always a triggering factor. There is a triggering factor. Now that triggering factor immediately it leads to aggression, right? I know a patient that if you snap chutki bajai and the patient starts pulling her hairs, right? The best treatment, which is considered as gold standard, it is called as the polyvagal therapy, right? We'll talk about polyvagal treatment or the therapy someday. But well, vagus, which is the 10th cranial nerve, it's a 10th cranial nerve, and it is the nerve which is affecting all the way, right? So for autism, this is considered as very effective. It is in fact considered as gold standard. So you're right, autism. Back to this, for the surgery. This is what we used to do, that for any of the surgical patient, if you really draw that, okay, this is the stomach and you have got the ulcer which is over here. So यहाँ से will be repairing it, and after that whatever you eat, right, you'll not be facing any problem, and this area would be protected. And yes, they will be very supportive, right? Immediately the whole attitude changes. So that's why maintain open communication, use all methods whatever is possible to explain properly. And this is like my personal experience. If you draw anything, right, whether on computer or on the single piece of paper, is far more effective as compared to showing PowerPoints, right? You show कि अच्छा है, this is the patient, right? अब देखो इसको ऐसा अच्छा हो गया, this is second patient, इसको ऐसा हो गया. But if you draw, if you write, if you tell them देखो यहाँ से यहाँ, तो then they feel very good and they are more supportive. Alcoholic patients, right? हाथ जोड़ लो, right? They have got low opinion of themselves and very difficult to convince, right? Very difficult to convince. But still, patient is patient, so you have to be supportive. Psychosomatic illness. Huh. In alcoholism, right? They listen to you. You know when they suffer from any damage, when damage has occurred. Psychosomatic illness. So there is anxiety, fear, depression, and all these things, they lead to angina, right? All the ulcers, there is headache, nausea, vomiting, indigestion. What medicines are usually given to alcoholic patients? Well, for what purpose? For what purpose? Because say alcohol affects liver, right? So any of the medicine when it is given, right, all are synthesized into the liver only, because once it is absorbed from the stomach, it comes into circulation. From there it will go into the portal circulation. That's where it is analyzed and then it is distributed. ठीक है ना? So say in pharmac, right, in pharmac, why do we study say side effects, or why do we study that these are the toxic levels or the toxicity? Because everything will be handled by liver, and that's where we study that whether it is affecting liver or not. For quitting, well, say for smoking, the way it is said that you can have all those specific tobacco based chewing gums, etc. Similarly for alcohol, right, the withdrawal symptoms, because sorry, the withdrawal symptoms are to be handled. So it literally goes from case to case, because there is no magic drug like they take that thing and chalo aaj se पीने से संन्यास, right? No, there is no magic pill like that. But well, you have to examine every case individually. Nothing works great like, say, taking care of yourself in the form of good diet. Because if the liver is affected, you need to correct it. Acha. So chest pain, ulcer, headache, nausea, vomiting, indigestion, all those things, they are part and parcel of it. Dying patient, emotional needs of such is normally ignored. Because people feel like कि वो तो अब ऐसे भी जाने वाले हैं. Okay. ठीक है. When we'll be discussing the liver, right? In fact, the liver pathology will take this point. Because it is not something which I can answer in 1 or 2 lines. Moving on to this dying patient, emotional needs of such is normally ignored, right? People feel like अब तो ये जाने वाले हैं, तो it is fine. So they are not given complete facilities also. So some can die, others cannot. So all you need to do is relieve symptoms to make remaining moments comfortable. Yes, you know that there is no point. There is no point or there is no solution for this particular person and he has to go. Recently, it's just before few days only, I had to advise one of my very good friend that let your brother go peacefully. Yeah, it hurts, but it was in the benefit of everyone. Otherwise, unnecessarily putting him in on ventilator when most of the cranial nuclei were gone, there was no hope. So then unnecessarily increasing the hospital bill, and then final result, so we know it that what is going to happen. So then why those who are living, they should suffer after spending so much money on the person who was destined to go, right? So at times you have to tell them that okay, just take care of those symptoms, whatever is happening right now. He is unable to eat, right? Stomach is not getting emptied. Yes, you know that, तो ठीक है, you just give Domstal. चलो, stomach emptying time is shortened, right? Food will pass on. You give cyclopam, तो चलो, it is relaxed and he is not feeling that much that pain. But because you know that cancer has spread across multiple ribs, liver, kidney, spleen, intestines, so then there is no point, right? Hopes also works rather than machines. Well, in movies, definitely. In movies, definitely, right? Because suddenly some light comes from some statue or from antariksh and person becomes fine. In reality, hope works when physically, when your body is if you can fight, this is your body, if you can fight, right? And if you fight bravely, it matters. It surely matters. I'm totally with you, right? It matters. But in our body there is a point, it's a tripping point. Below that, if it goes, so then it becomes very difficult, very difficult. But sure, hopes, I'll always agree with you. Yes, no doubt about it. We should not leave the hope, subject to that at one point of time, being a doctor, sometimes you are like swaying between doctor and mentality plays a role in such case. Yeah, I'm telling you this thing because in COVID, when I suffered from COVID, right, even this advice was given to me that बस यार तेरे पास अब 2 या 3 दिन ही हैं, right, from very good doctors. Yeah, because D dimer was 4900. C reactive protein, that was 176. There is out of this middle lobe that was totally collapsed. Right middle lobe totally collapsed. Oxygen that was hovering at 82%. And I was alone at the home treating by myself. But yes, I was in touch with good doctors. And whatever they said, I kept on following it very rigid, very strictly, very meticulously, right? And always talking to God, In fact, I don't know if I've told you this or not, but I used to write, right? There is one full skip book. And on that day, when my condition was very bad, I wrote 2 pages letter to the God also. It was a letter to God. So that's what really happened. So surely I believe in this, that don't let the hopes go till you come across. I myself has switched off ventilator switch of a very close relative, knowing that now the MO medulla oblongata, that is, there is no point because of hypoxia, it has gone into total shut off. So this ventilator, if it is switched off, even 5 minutes survival is not possible. So with very heavy heart, I had to take a decision, let him go. So it happens. At that point, it is like a fight between a doctor and a relative. Right? You are with heart, you are connected to that person. With, as a doctor, your brain is thinking something. So it is fight between your brain and your heart. So we have to be at times rational के चलो किसको जीतने देना है. So that's it for today. Next time we'll be once again going back to our original track of neurology, and we'll be starting with embryology. Right, we'll be discussing embryology in beautiful detail, so that rest of the entire examination of neurology and at the same time all the anatomy, it becomes crystal clear. Right, so thank you so much, and see you next time. I don't know what's the score of India now. Last I saw was 45 or 46 for 5 wickets. Right, in 20 runs we lost some 5 wickets. Anyway, maybe pitch of Indore is like that. Normally it should take turn on third day. It is taking turn right on the second day. More than 4.8 degrees of spin. So it would be interesting. Result would come. Oh, 102 for 8. Ay, shabash. My guess is if we make 115, I will win the match. 130, 125, 130 would be fine, because our spinners, they'll be spinning even more. Okay, so take care and see you next time. Bye bye.